Okay, hello everyone. We are right at 1 p.m. on the dot, so definitely want to be conscious of everyone's times, especially with little babies at home. Hopefully, some are sleeping. Welcome to the Starting Solids with Confidence webinar. I am Emma, the marketing manager at Odi, and with me today, of course, we have clinical nutritionist and founder of Odi, Gina Urlich, who will be taking us through all things starting solids. Just a quick IT logistics item from me is within the Zoom webinar layout, there should be a Q&A icon. I believe it's at the bottom of your screen. Feel free to write in any questions that you have throughout this session, and I will keep tabs on them and then run them by Gina at the end of the session. I have a feeling there might be a few, so we will try to get through as many as possible. We might go over the session just a few minutes, so feel free to stay on if that's the case. Otherwise, we will send a follow-up email with the webinar recording along with some of the questions we did not get around to answering. So with that, I would love to hand it over to Gina.
Thanks, Emma. Welcome, everybody. Thank you for everyone who's joining us today. If you are on this webinar, you are probably about to embark on this exciting milestone, or you're preparing to, or you're even in the thick of it. And I also know we have a few nutrition students here today who are keen to learn about this topic as well, which is so exciting. So this webinar is not medical advice. The objective of it is to educate and empower you with confidence when you're starting solids with your little ones. So I'm Gina. I am a clinical nutritionist. I have a background in nursing, and I am also the founder of Odi, as Emma mentioned. I'm also the mother to 4 beautiful children, 3 of them pictured there. The oldest one didn't want to be part of that. But it was actually after the birth of my 4th baby when I really started unpacking the infant nutrition space. And I wrote a little ebook on starting solids called Tiny Human, What Do I Feed You? Just because I could see that there was a gap with education outside of mainstream recommendations. And then whilst I did this, I then saw an even bigger gap in the market of commercial baby foods that were meeting some kind of nutrient requirement for infants. And so then Odi was born out of that. My real mission is to decrease diet-related diseases, and the area that we can have so much impact is in these early years. And how I can support you is by empowering you to make educated decisions about nutrition, but also providing healthy products for when you need them. So the first 1,000 days shape lifelong health. And that is a pretty strong statement and something that is great for us to kind of set the foundation on for this webinar. So the first 1,000 days start from conception all the way to a baby's 2nd birthday. And a baby's brain is actually doubling in size in the first year of their life. So you think about all the development that's happening in their tiny bodies. They literally go from rolling to running to babbling to talking in this short space of 1,000 days. And this is happening and is all dependent on nutrients from food. Nutrition is literally building brain cells, which is amazing. And so if we don't get adequate nutrition, it can actually cause irreversible delays as well. So this means that you can go back and fix blood tests, but you can't go back and rebuild a baby's brain. So we're going to go into a little bit more in depth about these certain nutrients that help do that. But as a foundation, these first 1,000 days have a huge amount of impact, not only on their health right now, but then also for the future. So the current recommendations is that we introduce solids around 6 months of age, so no earlier than 4 months and ideally no later than 7 months. But there is no magic number that says feed your baby on this date at this time. It's really dependent on your baby's individual developmental milestones in terms of their development when they're ready to start metabolizing and digesting food. So what I do recommend is that you look for these developmental milestones, and this will tell you that your baby's ready to start solids. So the very first thing that you'll probably notice is that they become interested in food, and particularly what you're eating. They may be trying to grab your food or opening their mouth to eat it, and it's very cute, and it almost feels mean to eat in front of them. But this isn't a standalone sign, and sometimes this can be misinterpreted as your baby's ready to start solids because they are so interested. But this isn't the only sign that we should be looking for. So the other one is that your baby can sit up unassisted. And this is really important that they've got this really strong core strength, and this helps move food through the digestive system. This is what we call peristalsis. So it's food moving through the small and the large intestine, and that's where we can absorb nutrients as well. Also, having really good head and neck control is really important. And if you do this yourself, if you were to tip your head forward or back, you're actually occluding your airway. And so we definitely do not want to be introducing solids to a little baby if their airway is occluded or not open and strong. So really got good head and neck control is really important as a safety measure. Sometimes we see babies being fed solids lying on a bouncer or a bit reclined. This is a real safety risk as well. We're really wanting babies to be able to sit in a high chair, unassisted, with good core strength and good head and neck control. Now, one of the other things is that we're born with a natural mechanism called a tongue thrust reflex, and this is to prevent us from choking on food, which is very clever. And around the time that babies are needing to introduce solids, we slowly lose this tongue thrust reflex. So a little test is what you can do is put a little bit of puree into your baby's mouth. And if they push it straight back out, then they're not quite ready. And I'd recommend trying again a week later. And then lastly is that they can coordinate breathing and swallowing. And generally when they're showing all of these signs, they're developmentally ready to start metabolizing, digesting, and absorbing nutrients from food. One thing I just wanted to touch on is this leaky gut or an open gut. So babies are born with this intestinal permeability, which is naturally higher at birth, and it's intentional and beneficial. So if you can see my hands, a baby's gut is open like this at birth. And this is so that all the beneficial immunoglobulins from breast milk and nutrients from breast milk and formula can pass freely into the bloodstream. And this builds a really strong, robust immune system. It supports their microbiome and allows for optimal nutrient absorption. Around that 6-month mark, when they're showing all those developmental signs of readiness, the gap junctions in the tummy start closing and they become nice and tight. Now, if we were to introduce solids a little bit too early and these gap junctions are still open, food particles are going to pass through into the bloodstream. And this is where we sometimes see eczema or allergies flaring up because solids are started a little bit too early. So that just speaks to really waiting for these developmental milestones before we start introducing solids. So when we start, my number one tip is to go slowly and be observant. And I think sometimes we think babies are ready to start solids and it's all in, but the biggest tip, if you take anything away from this today, is to go very slowly. We are not replacing their milk meals with food at this early stage. The food is supplementing their milk meals. So their breast milk or formula is going to be their first form of nutrition until around 12 months, and then food will take over. But at this early stage, go very slowly. Start with a teaspoon to begin with, and then slowly build up. You can even go every second day, but really slowly build up. If you go too fast too soon, we often see babies that get really constipated or they end up having sleep issues, which is the last thing anybody wants. So really slowly. 1 teaspoon of low allergenic foods. And then as we gradually increase the volume, we're also increasing textures as well. Now there's 2 different ways that we can feed babies. One is spoon feeding, which is very obvious what it is. It's feeding a baby with a spoon, puree. And then the other is baby-led weaning, which is a term used for babies that are feeding themselves. So spoon feeding is great for, how much food's going into the mouth. You can control what's going in. Whereas baby-led weaning, sometimes a lot ends up on the floor. Brownie points for your dog if your baby's baby-led weaning because they end up cleaning up the mess. Spoon feeding, you can play spoon tag with your baby as well. So sometimes babies like to grab a spoon when you're feeding them. If they're doing that, you can have two spoons on the go and you just keep rotating with the puree, load it up and pop it in their mouth. Baby-led weaning is great for their developmental milestones of the hand-to-mouth coordination and the pincer grip as well. And you can also combine both of these. So your babies are very intuitive and they will show you how they want to be fed. I've had 4 children and they've all been very different. So really lean into your baby and let them guide you on how they want to be fed and how much as well. They will show you very clearly when they've had enough. One note is that if you do spoon feed, is to try and start introducing finger foods by around the 9-month mark, because this is really important for their development of the hand to mouth and the pincer grip as well. And also embracing the mess. I know this is really hard when you maybe a clean person, but mess is really important, and we encourage little ones to play with their food. It's so important for their development. And it's only a short period where they're going to get very messy. And thankfully, we're coming into the warmer months, so you can strip them off at the moment and then chuck them into the bath afterwards. But it's really important for them to be able to play and explore the food as well. Another note is the environment is really important. So your baby's going to feed off your energy. So if you're feeling really calm and relaxed around a mealtime, then your baby's going to be picking up on their energy. Good to be feeding them at a time when they're not distracted or they're not tired. So an example is they may have had their morning sleep, they wake up, have a feed, a breastfeed or a formula feed, and then half an hour or so later, you could try with some solids. You know that they're alert and they're awake and they're not too tired or distracted. So the flavor window is something that I'm very fascinated about, and I think this is really exciting that we can lean into training, having the ability to train our babies' palates to like foods other than sweet. So from around 6 months, when they're showing all those signs that they're ready to start solids, till around the 12-month mark is what we call the flavor window. And this is a window of opportunity where we can introduce different foods to diversify their palate. So I really encourage things like savory foods, sour foods, salty foods, and spicy foods. Not too hot where you're going to burn their mouth, but really flavorsome food. And this will help diversify their palate to not be picky eaters later in life. On the flip side, with this opportunity again, there's vulnerability as well. So if we have this flavor window where we can train their palate, babies naturally favor sweet foods. Breast milk and formula is naturally very sweet. So if we were to just feed them a rice cereal or fruit puree that's very sweet and bland, then we're training their palate to like sweet and bland as well. So lots of flavor, lots of exposure to different foods and textures. One other point which I picked up from my own learnings is that to try and not let your own taste preferences impact what you feed your baby. I personally don't love sardines, and I was finding that this was influencing my preference on what I was feeding my baby, even though I knew that they were very nutrient dense. So get past your own taste preferences and really offer your baby lots of different flavors. So safety and confidence is really important when starting solids, and something that is really important for us to understand the difference between gagging and choking. So gagging can be quite noisy, it's very dramatic, and this serves as a protective mechanism to move food from the airway. This helps babies learn about the size and the shape that is safe to swallow. So babies are going to gag and it's quite dramatic and loud and they're coughing. This is a safe mechanism, and try not to rush in and get your fingers in there to pull food out or whack them on the back, because they might become alarmed or anxious around doing this coughing, this gagging. This is a natural mechanism that they're supposed to do. On the other hand, choking is very silent and it indicates that something is obstructing the airway and it's a medical emergency. So in that case, you would need to call an ambulance and you need to know CPR. So I really encourage parents and caregivers to learn CPR and first aid when they have a newborn, but particularly when starting solids. Some things, just some notes around this, is to always offer foods when seated and to always be supervised. Try not to give, definitely don't give babies food in the car when you can't see them. And we know that if choking is silent, we want to be in their view, we want to be able to see them. And then high risk foods like things like grapes or cherry tomatoes, make sure that they're cut in a way that they're not going to occlude the airway as well. So there are some key nutrients that we really want to emphasize when starting solids. And there is this saying, food before one is just for fun. And it is partly true. Food's definitely got to be about fun. But all of these developmental milestones that's happening in these first 1,000 days is dependent on some key nutrients from food. And iron is the top priority. So a 6-month-old baby needs 11 milligrams of iron per day, and an adult male needs 8 milligrams. So when we think about their portion size, every single mouthful matters, because getting 11 milligrams of iron into a little baby every day is a lot, and we don't have room for empty or nutrient devoid foods. So we have 3 different types of iron. One is heme iron. So heme iron is found in animal products. It comes from our organ meats, our red meats. Chicken thighs are really high in heme iron, and also oysters and salmon. To metabolize and absorb this iron, it's dependent on cofactors, vitamin A and copper. Now, Mother Nature gets it right every single time, and these natural whole foods naturally contain these cofactors. Another source of iron is non-heme iron, and this comes from plant-based foods. So things like your leafy greens, your spirulina, quinoa, tahini, they are non-heme irons. And to absorb this type of iron, we need a cofactor of vitamin C. So pairing vitamin C rich foods with the non-heme iron will help the absorption. Now, if you have a plant-based baby that doesn't eat animal products, you need to times the RDI of iron by 1.8. So a solely plant-based baby would need 19.8 milligrams of iron per day. That's a lot. So something to be mindful of if you're a plant-based family is you really need to prioritize getting the iron in. Then the third type is synthetic or fortified iron, and this is what we see in things like rice cereal. Predominantly through my clinical practice, this is the leading cause that I've seen of constipation and gastrointestinal upset. We're dumping free iron into the tummy with no cofactors for absorption, and this can cause a lot of inflammation, and it's paired with things like rice, which is a refined grain that's hard to digest, and then sometimes things like sunflower oil, which is quite inflammatory as well. So a synthetic or fortified rice cereal is a bit of a recipe for constipation and gastrointestinal upset, and is something that we've seen strongly through the clinic. Now, if just go back one for a sec, Emma, during pregnancy, in the last trimester of pregnancy is when babies are storing their iron, and they store it in their liver, and these iron stores take them to around that 6-month mark. So if you have a premature baby that's not had that full 3rd trimester to store iron, then the iron needs are going to be higher again. So something to be mindful of. Some other key nutrients that are really important for our growing babies is their healthy fats. So DHA from things like salmon, oily fish, also your fats from avocado, ghee, chia seeds, and olive oil. They're all really supportive, brain nourishing foods. Iodine is also really important. Iodine deficiency is the leading cause of cognitive delay in children. So it's really important that we're getting iodine into our little ones. And when I started researching different commercial foods on the market, it blew my mind that there were no foods that contained iodine. So we have a source of iodine from kelp in some of our purees to get the iodine in. Vitamin D and calcium are also very important for their bone growth and development in their muscles. We think about the growth that's happening in this first 1,000 days. This is dependent on these nutrients, and they work really well together synergistically to support each other. So again, whole foods, things from salmon, eggs, and also even vitamin D drops as well. And the last one there is choline. Choline's a really important B vitamin that's really important throughout pregnancy, but then also for our little babies. and we get a really rich source of choline through egg yolks. Now, when we're looking at allergens, which we're going to go into, the egg yolk is not the most common allergen. So an egg yolk is a really great first food for little ones to get that choline source and all those B vitamins. So these are some combinations of some first foods to try. So things like your bone broth and roast veggie puree, your egg yolk and grated liver, avocado, banana, and tahini, salmon and green peas, quinoa and apple or coconut chia pudding with berries. They're all really great first foods to try and really safe, non-allergenic first foods to try as well, bar the tahini, which is an allergen. So introducing allergens, we recommend the recommendation is that allergens are introduced within the first 12 months. And these are the top 9 allergens. Like any food can be an allergen, but these predominantly are the top 9. So when we're introducing allergens, sorry, just go to the next slide, Emma. We are offering low risk foods first. And then we're going to introduce, so say we know our baby's tolerating avocado really well, and has done for a period of time. Then if we're introducing an allergen, we can either add the allergen separately or we can pair it with a safe food that we know that they tolerate. We're offering allergens when babies are well. We don't want to be offering allergens when they're unwell, when their immune system's already heightened. And we're starting very small. So 1/4 teaspoon at a time mixed with a familiar safe food is a good place to start. And then we're waiting 3 to 4 days between exposures before having another exposure. So say you start an allergen, 1/4 teaspoon, 4 days later you'd try again, and then another 4 days later you'd try again, and then another 4 days later you'd try again. So they've had 4 exposures. Generally, we see if there is going to be a reaction, it doesn't generally happen on that first exposure. It can happen in the second, third, or fourth exposure. So something to be aware of. Watch out for signs, so things like hives or swelling or an upset tummy, and just staying consistent. So once they've tolerated it, then you just keep it consistent in the diet. So these are some of the signs that you may notice if there is an allergy or a sensitivity. So a mild rash or dots around the mouth is a very mild sensitivity. If we're looking at an allergy that's severe, you would see swelling in the face or throat. There'd be difficulty breathing, vomiting, weakness, or floppiness. And if there is a reaction, you stop feeding straight away and then you wipe the food off their hands and face and observe. Obviously, if there's an issue with breathing or swelling or anything like that, you call an ambulance. One thing that I really love is this division of responsibility, and you can start this right from the get-go and then keep it going as your children get older as well. So the division of responsibility is, as caregivers, as parents, you provide what they eat, when they eat, and where the food is offered, and then they decide whether to eat it and how much to eat it. And by doing this, we build trust in food and appetite. So there's no pressure or bribing. We're not saying eat your peas and then you get ice cream. We're developing self regulation, and they'll learn to stop when they're full and then they'll eat when they're hungry. And that division of responsibility actually helps with picky eating. Babies are generally very compliant, which is great, and they definitely generally are quite like well received of different flavors and foods. And they may pull funny faces to begin with, but this is fine. Just keep it in exposure. But sometimes we then go into phases of having picky eaters. I have one. I know how challenging it can be, but keeping a routine is really important for these little ones. So even if they're past the starting solid stage and they're becoming toddlers or even school-age children, routine is really important. It keeps them safe and they know what's happening and they know what's coming. Serve small, frequent meals as well. So if they were to eat it all, you can give them more, but sometimes if we overload the plate, it's too much. And I sometimes use this guide of a hand as a rule when serving a plate. So if you look at your own hand, and you can also look at your child's hand for the size, the palm size of your hand is what we would be serving as a protein. So that would be my protein serve, and then my child's would be the size of their palm. Then the middle 3 fingers is a serving of fat. And then your whole palm would be your carbohydrates. So your potatoes or your rice or your quinoa or something like that. And then you can fill with non-starchy carbs as well. So use their little hand as a guide because it's actually such a tiny little amount. They don't need too much on their plate. Another really good thing for us to practice is being a role model and leading by example. Monkey see, monkey do. If they're seeing us eat and we're sitting together at a table and enjoying food together, then they're more likely to um, do the same. So I would really encourage if everyone could try and do one meal a day at the table together. I know it's really difficult sometimes with different work schedules and things like that, but the impact that we can have on our children's eating if we're all sitting together at a table is phenomenal. There's so much research around the impact that we can have eating as families. Um, and then letting them get hands on. So whether it's in the veggie garden or preparing dinner or even just putting everything on the table and letting them build their own meal. For example, if we were to have something like rice paper rolls and I was to put all the food on the table, then they could build their own one. They're much more inclined to eat a variety of foods as opposed to me putting it on a plate and doing it for them. And then smoothies. I always say smoothies are a parent's secret weapon because you can hide so many nutrients in there. And that's kind of what we're doing with our Odi boosters. So we have an Odi smoothie booster that's full of nutrients that we can disguise into their favorite smoothie. Or if there was another safe food, something like a macaroni cheese, as an example, you could add the meal booster and the bone broth in there. You know that it's a safe food that they're going to eat. You're going to fill the gaps while their palate's developing and add those nutrients in there, but then keep food on the plate as an exposure as well. So this is our last slide, the world of Odi. So Odi is nutrient dense foods for babies and children and the whole family. So we've got purees, which are in a powder form. They're freeze dried. The freeze drying process retains all the nutrients from whole foods, and the ingredients are like what we've just spoken about, ingredients that contain those essential nutrients that little ones need. So things like our beef liver, our quinoa, kelp, all these nutrient-rich foods, bone broth, to get nutrients as whole foods without synthetic vitamins into little people and the whole family. And so, yeah, the purees you add the water to, mix it, and it turns into a puree. And then the boosters is what you can add into the likes of a smoothie, mix it into yogurt or into your family meals as well. So that's a real snapshot in 30 minutes of starting solids. There is so much more that we can expand on in this, and we might have to do a part two because I feel like we could delve right into allergies and we could delve right into these essential nutrients as well. That was a high level overview, but if there are any questions, feel free to send them through.
Amazing. Well, thank you so much, Gina. That was packed of very useful info, including for myself too, because I have a little one. This is very relevant.
Mhm.
I see a few questions already. And again, if others have questions, feel free to pop them into that Q&A box. So just going to run through a few while we still have a few minutes. Again, we might go a couple minutes over. If you have to jump, no worries. So, Gina, could you just talk through the flavor window a bit more? Is there a specific time period that you were saying the flavor window is like really open and an opportune time?
Yeah, so right from the moment that we're starting solids is where we have this flavor window, and that can go up to around the 12-month mark, but particularly at the start. And historically, we've seen a lot of baby foods be very bland or very sweet. And this has then led into research around this flavor window, where actually, if we're introducing all these diverse flavors very early on, then we're going to diversify the palate. So from the get-go, good flavor profiles and all those different kind of things that you predominantly wouldn't think that you'd give to babies. So all the herbs and spices, and then salty and sour and things like that too. Even give them a little bit of lemon and watch their face. You'd see that they'll pull a funny face, but they'll go back for more. So really important just to watch them and see how they pull those funny faces.
And those faces are very cute and
Yeah.
entertaining. So here's a bit of a unique one, but I'm sure there's a few that could relate. So what about twins? Would you recommend feeding them at the same time, doing one at a time so you can be a bit more engaged per child? Any tips there?
Yeah, I guess it comes down to your level of confidence and where you feel it's a good place to be as well. So I know with twins, they often feed off each other in terms of mirroring each other as well. So if one's eating, the other one's going to copy and things like that. So, and I guess when you're looking at the logistics of preparing food and the cleanup, kind of easier to do it all at once, but it comes down to your level of confidence and where you feel safe in terms of, I guess, maybe if you're introducing allergens, you might want to do that separately, but those other safe foods could be good to do together.
And then this is a question more related to the mother, but a great one. So, any suggestions around optimizing the nutrients of breast milk while breastfeeding? This is probably a whole other topic for another webinar, but just to touch on it would be great.
Yeah, this is a whole nother webinar, but something that I'm really passionate about as well. So a lactating mum needs more nutrients than what she did during pregnancy. So during this time, really important to keep up with your your natal vitamin, particularly things like iodine as well in this period of time. Macronutrient balanced food. So again, use that hand as your guide, your protein source, your good fats, and your carbohydrates, so that you're having macronutrient balanced meals. Hydration is so important because you're expelling so much as well. You're wanting to make sure that you're hydrated. So even electrolytes can go really far, particularly coming into the warmer weather too. Um, and yeah, it would just be increasing your calorie intake more so than when you were pregnant.
And I'm seeing a few questions on this, and I too agree it could be a bit confusing just around certain ingredients to avoid. We hear a lot around avoiding salt. So can you just talk through more sort of the differences with flavor windows that might taste a bit salty versus, more processed salts and things like that?
Yeah, and I think you said it there, Emma. So processed salts are very different to salt that's naturally occurring in foods. So we're wanting to avoid processed foods with a lot of salt, but natural foods that have some salt in it, like some sauerkraut and things like that, is actually okay for babies. They are fine to have a little bit of salt in their diet. If we're looking at foods to avoid, the one food that we're wanting to avoid is honey because of botulism. So no honey under 12 months, but a little bit of salt exposure through natural whole foods is fine. And
And again,
sauerkraut juice is great. If you were just to push a spoon down into a jar of sauerkraut and get some of the juice out, there's so many probiotics, all the beneficial bacteria from sauerkraut and fermented foods. Clover ferments is another great one of fermented foods that's got that bit of saltiness as well, but also all the beneficial bacteria that's going to build their microbiome.
great. And I think we will end with one final question here. Again, we can probably do a round two where we spotlight allergies a bit more. But what about if a child is showing signs of a mild allergy or even eczema? Should a parent completely stop exposing a child to a particular food or try to do it a bit more gradually?
It would depend on the extent of the eczema and the allergy that's been shown. So if it was just a few little dots around the mouth, to me that's very mild. If there was a lot of eczema or there was some allergies flaring up, then I would be wanting to work on the gut microbiome. So, and also that gut integrity as well. So, particularly with eczema, we know that beneficial bacteria in the gut is going to help with that inflammation on the skin. Also, things like essential fatty acids. So, cod liver oil is really great for little ones with eczema. One, it's got the vitamin A and the vitamin D in the cod liver oil. That's really anti inflammatory, but then also the omega 3s that are going to get to the skin as well. Um, and then I would just be pulling back on some of those allergens like gluten and dairy while you're dealing with the eczema. But that's a great topic, and it's probably something that we can do a whole nother webinar on. Eczema in itself is a big topic.
And just a quick follow-up there, any high-level tips on breastfeeding with an allergy? Should the mother avoid that particular food?
You can do an elimination diet. If a baby's getting an allergy just from breast milk, then you can do an elimination diet as a mother. Yeah.
Mhm. Great. Well, thank you, everyone. Such great questions. And again, we will be sending out a follow-up email with a recording, and there will be a reply email address as well. So if you have other questions, please don't hesitate to reach out. And we so appreciate you joining. And big thanks to Gina for walking us through all of this information.
Thanks, Emma. Thank you.
Thanks. Bye-bye.
Bye.